meeting. Just give him a couple of minutes.
Sure, no problem.
Hi, Cynthia. Thanks so much for joining us. It's Dan Stein here.
Good to see you.
All right, let's give people maybe just a minute. I think, Mark, you obviously did the invitation to Cynthia.
Yeah, so Dan, I don't know if you're going to say anything about Cynthia's background, or maybe Cynthia can tell us herself, but I just want to say that I just want to get the title of the book up on my screen. This all started when I read a review in local media of the systems work of social change, which you co-authored with Francois Bonici, which was not an unfamiliar name to me, because I think that his father was a professor of medicine when I was medical school. Maybe Dan remembers that too. But the book and the content looked so interesting, and I managed to make contact with you, and I want to thank you so much for being so enthusiastic in responding and being so willing to talk to our department. And although the contents of the book do not seem to be directly about mental health, when you and I discussed that through an email communication, you were very excited about the potential application of your model and your work. And so we're very excited to see what you're going to tell us today.
So that's great. Thanks so much for that brief introduction. So Mark, Cynthia heads up our Social Responsibility Committee, which organizes this particular lecture. We have a weekly lecture, but we rotate, and this one is on social responsibility, which you then would fit in under umbrella, you would fit under. I also think it's great that Mark came across your name by a book reading. And so anyone else that's read an interesting book and wants to bring an interesting author, please go ahead and do that, either yourself or via one of the committees. That's awesome. I think the other thing that comes to mind, just you will have all have received Cynthia's bio, saying she's a researcher, writer, and lecturer affiliated with the Bertha Center for Social Innovation at the University of Cape Town Graduate School of Business. And her research focuses on how organizations and communities work to shape social systems in collective ways. And I think what comes to mind there, people may not know that it's the Nestat family and related families who have been the philanthropists behind the Bertha Center. Also people from South African universities, and some of whom are very involved in mental health. So there are natural synergies to develop between the Bertha Center and mental health, which I don't think, Cynthia, you may well want to contradict me on this, but I'm not aware of a focus on mental health that much, and perhaps that's something that could be really considered in greater depth in the future. And then I see this other thing from her CV to bring to your attention. She is a recovering management consultant. And I thought that was an interesting choice of phraseology, and fits with conversations that we've been having in our department about the importance of governance, importance of good management, but with some people also raising a fair degree of skepticism about what a managerial perspective really brings. So with that, over to you, Cynthia. Thanks again so much for being willing to do this.
Well, thank you both for having me, and thank you to this group. It's such a nice size group. I wasn't sure what to expect. It's 5:30 in the morning here. I'm in Austin, Texas, so I'm joining you very early in the morning with a strong cup of coffee. And you might wonder, why is an American woman from Austin, Texas speaking to you, affiliated with the Bertha Center at the business school? So I'll just give a little bit of my journey and then we can dive into the material. I'm very excited about the intersections that Mark and I discovered just with a brief email exchange. And let's just consider this the start of a conversation and see where it goes. So my journey to South Africa, about 12 years ago, I was working as a management consultant, had finished my MBA and felt like I was ready to launch into the business world. And in fact, was deterred by a fellowship that brought me to Cape Town to work for an organization called Mothers to Mothers. I don't know if anyone is familiar with Mothers to Mothers, but Mothers to Mothers is an organization that is based out of Cape Town, but works across sub-Saharan Africa and works with mothers living with HIV. Their original mandate was to work on the prevention of mother-to-child transmission of HIV, but then they've since expanded their remit to broader maternal and child health. Through that fellowship, and then later on working for them, I was introduced to Dr. Francois Bonici. At the time, he was returning from a stint in Switzerland and was meeting organizations across South Africa as he was starting the Bertha Center. He and I became friends, and then over time, I started working to write case studies for the Bertha Center and became more closely affiliated with the business school. I've since started my PhD studies, so it's been a long journey. But as we were looking at the organizations that we were being exposed to, that we were working with at the Bertha Center, we became more and more concerned that there were frustrations that we were experiencing, things that we were seeing that were happening at the global scale, discussions about concepts called systems change. And then we saw organizations working in communities in South Africa that weren't being recognized for the real systemic work that they were doing. It seemed as if there was a conversation at the global scale, often amongst funders, about how we could make systems change. And then there was actual on the ground work that was happening by communities, within communities, that was being overlooked. So we went on a journey to find organizations that were doing what we started to call systems work, work within systems, but done by community members to actually shift systems in the direction that they wanted to see their communities go in. And we really tried to meet the global conversation, but also tell the stories from communities. And that's what I'm going to talk to you about today. It was a 5-year journey. It was quite a long process. We met organizations from across the global south. We spent time with organizations working in fields such as education, health, community development, youth development, job creation, economic development. And each of these organizations that we spent time with, we were looking to find out what are the ways that they believe that they can influence and drive systemic change, but from the community level on up. So I'm going to share, I hope that gives a little bit of context as to why I'm here, but we can definitely spend time on Q&A. I don't want to talk the whole time. So I'll spend about the next 30 to 35 minutes going through the material, and then I'm going to open it up to questions. So please feel free to jot down your questions as we're going. Questions and comments. Okay, I'm going to go ahead and share my screen if that's okay. And what I'd like to do first is kind of walk you through the thinking behind the book. So I'm going to be talking a little bit about why this book, why now? What is this idea of systems change? Why is this a pertinent issue? Why might this be something that we might be talking about today in many different sectors, many different fields? Then we're going to talk about the framing of the book, which is around the idea that systems are complex, that they are large scale, and that they have depth. And then we'll talk about the findings from the research. So what were the principles and practices of systems work that we found in the organizations that we spent time with? I'm going to do a little bit of an application exercise. This is only a thought exercise, something for you to take away with. I always like to give a gift when I do these presentations, and then we'll wrap up with Q&A. What do we mean by systems change? I've actually added this slide in the last few months because since I've been in the United States, back in the US, I've been working with a gentleman by the name of John Kenya, and this is his model for systems change. And I think it's really instructive and helpful to kind of break down what we mean when we think, how do we change social systems? What are the ways in which we can influence social systems to act in more positive ways? And he likes to break down systems change into 6 conditions that we can influence, both as professionals, but also as community members. And remember that this is a whole body of actors that are working within systems. It's professionals, but it's also community members, activists, social justice influencers, community activists, community organizers, all of these individuals who are working to influence their systems in positive ways. So at the top here, I think these are the conditions that we are most familiar with. These are the things that probably we are working to influence on a day-to-day basis. And that is things like practices. How do we actually work in new ways within a system? But also on the left and the right there, policies. So how do we work with government to promote better policies in the ways that we see fit? And then how do we influence resource flows? So how do we try to ensure that the resources are flowing towards the things that are going to be most positive in our communities? But what we might not realize is that underneath the surface, there are other things that are influencing systemic change. And oftentimes these can have more influence than those top level things that we are working on a day-to-day basis to shift. And the 2 in the middle there, those orange blocks, are the relationships and connections. And these are things that are explicit, things that we get to see, the relationships that are on the surface. They're also implicit, the family relationships, the community relationships that often drive the ways we believe and behave. And then also there's power dynamics, and those power dynamics can influence who we believe to have knowledge, who we believe to have expertise, and who we believe to have decision-making power in communities, in institutions. And then last but not least, at the very bottom there, these are the things that are the biggest driver of all of these things. These are the implicit level, the things that are happening beneath the surface. And I think many of you would agree with me that these are the things that can create the transformative change that can actually influence our communities for the better. And these are the mental models. These are the things that we don't even think about, the things that drive our behavior, but oftentimes are operating below the surface, very, very deep. And in order to transform those things, we have to go very deep in order to do that. So when we talk about 6 conditions of systems change, what we'll be talking about today are not just the things at the top level, which are often the things that are talked about in business schools, amongst MBAs, amongst management consultants, but we're going to go deeper and we're going to think about the things that influence those relational change as well as the transformative change. What else drives this research? Well, when Francois and I were looking at the organizations that we were studying, we realized that many of them are influenced by a system in which we operate that is very difficult to influence, and this is the industry of social change. Now, this seems really broad. It's of course driven by many, many different institutions and organizations and individuals. But what we realized was that this industry has actually shifted very much over the last 200 years. So whereas 200 years ago, a lot of social change was driven at the very community-based level, we've moved to a world in which this is driven very much by global factors and by national factors that often feel beyond our control. And it's driven by what I would call an industrial mindset. So we believe that we can exchange resources in pursuit of public goods and private goods. And these public and private goods can be used to pursue technical goals, to stave off poverty, disease, hunger, many other issues. And oftentimes countries and global institutions are quote unquote trying to purchase these public goods with the resources they have at hand. And many of us are working in that system. And oftentimes we find ourselves at odds with that system because the way the system has grown up to believe that many of these technical goals can be pursued by the exchange of money and resources and expertise oftentimes confronts realities in communities that are not as such. So what do we say in response to that? What are the things that are operating beneath the surface in this industry of social change? Well, the social change, and I think many of you would agree, are social challenges, made up of social challenges, but they are challenges that have features that are very difficult to understand with just a simple mindset. So there's complexity in our social challenges, there's scale, and we'll talk about a little bit about what that each of these mean. And there's depth. So what do we mean by complexity? Well, first of all, complexity is relationship-based, and these are drawn from different fields of complexity science, and they're kind of an amalgamation of different findings. But most of all, complexity is relationship-based, and you cannot isolate the parts. The idea of complexity is that, in fact, so many different variables are influencing one another that to break it apart means that the sum is greater than the parts, and you can't influence things just by looking at a single part. And there's no single formulation of the problem. I think you'll probably experience this in many of your department meetings, is the fact that there's lots of disagreement. And in fact, this disagreement is a virtue, not a vice, because we don't have single solutions. Just one solution isn't going to be the way we solve a problem. In fact, because there are many unique situations, many unique contexts, we need a plurality of solutions. Solutions are not just true and false. They're not just good and poor, but they are, sorry, I'm saying this wrong. Solutions are not true and false, but they're good and poor. And we can actually test things in order to find out what's working and what's not. The other thing is that the shifting of systems means that every time we make something in a system change, we influence the whole thing. So we will have things that will be tossed up by our influence that we cannot control. So what do we mean by large scale? I think oftentimes we think of large scale as being just the size, but we also can think of it in the business sort of things as economic, that we can have more influence or more economies of scale by increasing throughput in a system. But the problem by thinking that way is that wicked problems, the type of complex problems that we are working with, have no stopping point. So if we just replicate a solution over and over again, we'll find that the result will actually change every time we make an input into the system. So what's a better way to think about scale? I like to think about scale as two different things. The first is scale as thinking about it in terms of efficiency. And this means we can have marginally high impacts if we increase the number of times we do something in a system. But in a complex system, it's better for us to think about how the system responds when its size changes. So if you grow a program, if you grow an intervention, what happens when the system becomes bigger? If I try to do something in one context and then I move it to another context, what are the ways that my system now changes? What are the ways my program changes? What are the ways the influence of that introduction of an intervention can change? And we don't fully understand this. Even scientists who have studied complex adaptive systems for many, many decades for their entire careers will say that, in fact, we don't fully understand how complex adaptive systems relate to scale. It's an ongoing discovery process. And then what do we mean by depth? I think this is the one that Francois and I were most intrigued by, was that oftentimes as program developers, as research scientists, as experts, we often fail to understand the deeply held beliefs, the values, and the assumptions that are extraordinarily difficult to shift. I don't think that this group, in fact, would find that to be a big discovery, but unfortunately in a business school, it felt like a big discovery, that in fact we cannot change if we cannot imagine change. And oftentimes this is a real barrier to change. And then in addition to this, that we are the systems we seek to change. So by participating in them, either as perceived experts or as community members or as interventionists, I say that with a very light touch, we're participating in them. We bring into them our beliefs, we bring into them our identities. And so we can maintain and extend those power dynamics just by the very fact of being in them. So we have to be very reflexive about who we are to drive change. So who should drive change? This was such a big question on our mind as we were looking at the organizations that we were studying, and we'll get into some case studies right now. We'll get away from the theory and into the actual application and practical side of things. But first, I think it's really important to think about who should drive change. In many cases, many of the organizations that we had been involved with, particularly those that we were talking about and intersecting with at the global scale, we're oftentimes thinking of themselves as the actors. Well, we need to drive change. We as organizational leaders, as funders, as policymakers, we need to drive change. But in fact, what we found was a point of huge difference in those organizations that were working deeply in communities to drive change, was that that was not their belief at all. In fact, their belief was that it should be community members themselves, the primary actors, those who are closest to the issues at hand. I like to call that the point of greatest complexity in the system. They are in fact the ones who should be driving the change, imagining the change, believing the change that they want to see, and then acting to drive that. And in fact, those who are sitting in the funding realm and the policy realm are the supporting actors. They are there to drive the resources towards those primary actors and to develop capacity and influence, and possibly even to share power. But in fact, it's primary actors who are going to have the best solutions and the best way to drive a system forward towards positive change. Okay, what does this look like in reality? So we studied 8 organizations. Many of them were in South Africa and on the broader African continent. Others were in other parts of the world. We also had interactions through the Bertha Center with many other organizations, and we were testing our findings with them. We spent time running a course for 3 years called Systems Change and Social Entrepreneurship. And through that, we were exposed to 100+ organizations. And we were working with these frameworks and really seeing if they were resonant with those organizations. And out of this work, we had 3 principles that we saw that each of these organizations were working with. The first was this desire to foster connection amongst those primary actors. And these are not sequential, but in many cases, this was a foundational effort to build communities and connection amongst those primary actors who are the primary drivers of change. The second was to embrace context, not to try and mitigate it, but in fact to fully work within the context, to use those things that are positive and in fact assets within a system to be able to drive change towards the positive view that primary actors want to see. And then the last piece here is the reconfiguration of power, so that those primary actors have the power and the decision-making ability to drive change going forward. So truly to institutionalize that power in communities. Okay, I'll dive into each of these and give a case study, which I hope will give a little bit more detail. We went down to the practice level. So we took each of these principles, and they don't relate directly. So there's not formal linkages between each of them. In fact, each of these practices are propping up the principles that you see here. And when we talk through these case studies, we're going to talk through them at the practice level. The first of these sits in the Cultivate collectives bucket. And this was a lot of that work to foster connection, but then it was driven through the embracing of context and the reconfiguration of power. A piece of embracing context, as you can see it relates there, is equipping problem solvers. So who are the people at the community level who are working to solve problems on a day-to-day level, and how can those problem solvers become best equipped to do that? Then promoting of platforms is really the ability to take the cultivation of a collective identity and the problem solving abilities and drive it across multiple geographies through a platform approach. And then finally, disrupting patterns and policies. This was where we discovered that in fact, patterns of behavior can be driven by policies, but it can also be vice versa. So a policy isn't going to necessarily drive a pattern of behavior. Oftentimes it happens in the reverse way. And then each of our case studies, and if you do want to spend time in the book, we have these built out in an appendix. It's a way to kind of flip through the book and not have to read the whole thing. Each of our case studies really drives down through these. They go through the context, what's happening at the contextual level, what's happening at that surface level, what's their programmatic work, but then really what's happening beneath the surface to drive the deep systems change that each of these organizations is seeking. Okay, what do we mean by cultivate collectives? This was the first practice that we discovered. Really here we're looking at cultivating a new web of relationships and staying together while learning. And I'd like to look at Mothers to Mothers as our first case study. Now, as I told you, I worked for Mothers to Mothers for 3 years. So full disclaimer, I have a strong love for this organization and was able to kind of see them from the inside out. What does Mothers to Mothers do? Well, Mothers to Mothers, as I said, is working to promote women living with HIV as healthcare workers in the system. So they are lay workers, but they enter into the health system and they act as supporting agents to mothers to be who are living with HIV, as well as broader families, to work on promoting maternal and child health within health systems. And what I think is truly beautiful about this program is that they work within the system. So oftentimes they're in clinics, occupying a small space as women enter the system and are diagnosed as HIV positive. They are then able to be referred to the Mothers to Mothers program, where they are then given support through support groups and individual peer counseling in order to be able to adopt behaviors that are going to prevent transmission of HIV to their babies. And then later on, they build a community around those mothers so that they can support the positive behaviors that are going to support maternal and child health. So that's the surface work. That's the thing that they are doing at the surface. That's the thing they talk about to the outside world. But what we found was that a big piece of their work was cultivating collectives. And in this way, it's collectives of mothers and mothers to be. And around that, they are building a we, something that is their collective identity, that is about being a mother living with HIV and about being a strong promoter of these positive maternal and child behaviors, and then using that to shift a stigmatized identity to a prideful identity. So what can we take away from that is extremely prideful and that can actually build a place where I can become the mother I want to be? Also, within these clinics, they're hosting havens, is what we called it, the ability to kind of walk away from the things that are maybe overwhelming in their day-to-day lives and have a place of safety where they can discuss what they are becoming in these new identities. And then this idea of pooling, this was where stories are shared and where stories from the mothers as well as the mothers to be can be shared and new identities can be formed. So I'm not going to go into real detail here. I can share these slides afterwards. I know we've got limited time, but really driving down here as to what are these things about cultivating collectives that truly drive the deep systems change. And really what we found was the deep systems change here is not so much the prevention of mother-to-child transmission of HIV, which is of course the important result, but rather transforming mental models about who can be healthcare workers, who can be the source of expertise and the source of knowledge in a healthcare system. And in this case, ensuring that mothers living with HIV, women living with HIV can be that source of expertise in a healthcare system. Okay, I'll move on to the next one now, and this is equipping problem solvers. Now, each of these case studies exhibits many of these things. So as I go through the case studies, you might hear things that are resonant from previous case studies, but it's just that many of these organizations exhibited many of these practices. But the second idea of equipping problem solvers really directly addresses that idea that organizations, programs can be contextually responsive. They can actually harness the unique abilities, assets of a system, of a unique local system. And they do that by the people that are working in that system on a day-to-day basis. So what do we mean by this? Let's look at an organization called Family Independence Initiative. This is an organization that is based out of California. They're a US organization, but they have since grown to be in other parts of the world as well. They're now operating under the name of Community Independence Initiative. And the kind of surface work that this organization does is it develops peer groups or family groups within communities that are self-selected. So in order to be enrolled in the FII program, you have to come with a group of your neighbors or of your community members that you would like to be in partnership with. And then FII will deliver to you in your household a computer, and that computer will allow you to track your spending habits. So this is quote unquote a poverty alleviation program, but I would say at its heart, it's a community empowerment program. Families are encouraged to meet with their peer groups on a month-to-month basis and to share their spending patterns. So it's things like, what did I spend on groceries this month? What did I spend on childcare? And they're also encouraged to help each other out when there are challenges. What FII has realized is that they in fact cannot be the helpers. So FII staff are not allowed to intervene at all in these peer groups. They're only allowed to support the peer groups from meeting on a regular basis. And then they aggregate all of that data that are coming from the computer systems, from the journaling. And then through those data sharing, families start to change their patterns of behavior and start to pull themselves out of poverty. So what are the practices that we saw, the tactics that we saw? Well, first of all, it's circulating data. So the problem solvers in this case are the families themselves. They're empowered to solve their own problems of poverty, but also work within each group to solve each other's problems. So say, for example, a family doesn't have the money for childcare that month. Another family might offer up help. They might come up with a way to support it within their family group. They might also give referrals to each other as to who can help. Somebody might need a job within the group, and oftentimes they'll help refer each other to different job opportunities. So when we talk about big and small data, we're talking about that big aggregated data, but we're also talking about the small data transfer that's happening in those groups. There's also decentralized decision-making. So in this case, it's families making decisions for their own families. There's no top-down decision-making. There's no preferred behavior in this case. It's just whatever works. Positioning problem solvers, in this case, it's the group themselves coming together through their own peers. They get to select. The groups are not formed by an outside party. And then how do you sustain the motivation? In this case, it's oftentimes rewards. So families will have to contribute their own funds, but then if they meet certain milestones, they'll get additional reward funds from FII to continue those positive strategies that they are using in their lives. So again, I won't go into great detail here. I'll share the slides, but you can see here that there's a lot of different things that are happening beneath the surface. And a lot of this was about very much changing the idea that the experts are the social workers who are sitting at FII, and realizing that those who are in families, those who are peers, are actually the drivers of and the source of expertise themselves. Okay, third case study is promoting of platforms. So what we realized was that many of these organizations were working in these deeply contextual ways, but then they were also working at a platform level to try and share learnings across geographies. And this is where you connect groups to one another to share those learnings and to start to cycle into large scale action. And you can see the difference here of kind of using that grassroots connections across at a lateral level, rather than trying to develop a program that comes from the outside in and tries to plant different programs in communities. It's very much a bottoms-up approach rather than a top-down approach. And the organization, we actually have a couple of organizations that we studied here, but the one that I am most close to is Child and Youth Finance International. This, in fact, is a group that has closed, and they've closed because they have said, you know, in fact, we've succeeded what we set out to do, which was create a global community of policymakers and educators who were promoting financial education within both education systems and financial systems. And when we looked at what this organization was doing at a practice level, we realized that they were taking groups who are, again, very much contextual, sitting oftentimes at the national level or at the regional level with the subnational level, and linking those groups together. So oftentimes they were having convenings at a regional level or a national level, and these groups were sharing with each other what are the policies that are promoting better introduction of financial education into our education systems. And then they were returning from those convenings and going back into their political systems and able to drive change. It was also bankers, so financial ministers who were meeting together who were saying, okay, if we see that on a long-term basis that financial education is key as an economic driver, how are we going to actually introduce policies into our financial system that are going to drive change and better educate children into our as educated as economic citizens, was what they called it. Observing rituals. This is a funny one because we thought, what better way to talk about rituals than in a group of financiers and of bankers? But in fact, they did. They had many different ways that they would meet together and celebrate and bring children into the mix that felt almost like the church of economic education, if you will. They oftentimes encouraged collaboration amongst these groups, but always with flexibility. So there was never this kind of driving force of the policy must look like this. It was a sharing of information. So a policy could look like this. Now go and adopt it in your own context. And then this was a fun one, this moving from outrageous to acceptable. The idea here was that in many times they would put these huge goals out, 100 million children influenced by this program in 10 years. But over time, these outrageous goals would actually drive people's motivations and become acceptable over the course of time. Again, you can look at this in more detail later, but the idea that there's this context work, what they were doing at the top level, but lots of different things beneath the surface that were creating the deep systems change. Okay, last practice, and then I would love to open it up to questions. So get your questions ready, please, or even comments. I would love to know if this is resonating with you or not. The last practice here is around disrupting policies and patterns. And oftentimes what we realized was that many organizations were talking about the policy change that they wanted to see in the world. But in fact, at a deeper level, they were working on patterns of behavior that made those policies almost inevitable. And then oftentimes organizations were working in the other direction. They were driving really hard on an activist level to make a policy change. And then in fact, afterwards, spending many years, in fact, decades, to change the patterns of behaviors deeply in communities that policy now allowed them to implement. So it's kind of changing the rules of the game while also changing the ways of being. And the organization that I'll highlight here is an organization called NIDAN. NIDAN works out of Bihar in India, one of the most impoverished states of India. And they work closely with street vendors, but also more broadly informal workers. And the program that we studied most closely was a street vendor program to actually drive a policy agenda towards having a Street Vendors Act in India. And the idea here was that street vendors are informal workers who are often providing a much needed service in cities and urban areas, providing cheap food to workers, but in fact they were under-recognized and unlegitimized as a part of the working community, part of the urban life in India. And the idea was to drive a policy that gave those street vendors legitimacy, ID cards, rights, the ability to actually operate in a place of safety and ply their trade, but with the same protections that other industries were able to do. And what NIDAN found was that, in fact, they could agitate for these policies of participation. So they had huge multi-million people marches and hunger strikes that were promoting this idea of the Street Vendors Act. But at the same time, they were working at a very local level to ensure that street vendors had positions of decision-making at the local level on town vending committees. So this means that you can't just drive a big political movement. There has to be a lot of grassroots work so that after the act is passed, after the policy is made, that there is a lot of that local work that is going to actually put those people in positions of decision making to drive true change. And this iterating between the policies, the kind of things that hit the headlines, and the actual patterns in communities that really make change real in the lives of individuals has to happen as an iteration. It's always a balancing act between where you put your energy. Medan, again, at that contextual level, at that surface level, working to make sure that informal work is seen as something that can actually be legitimized. But that deep systems change, a true understanding of the value of informal labor, having both policymakers as well as people on the street believe that those informal workers are a driving source of economic vitality in their communities. Okay, so I'm going to just leave you with this. I teach a lot in classrooms, but this is really where you can apply this to programs that you may be developing into your own work on a day-to-day basis, but really thinking deeply about who are the primary actors in your system, not thinking of the classic experts as the source of expertise and knowledge in a system, but rather seeing those who are the primary actors working at the local level as the true drivers of change. And then thinking about these 4 practices as to a way to deepen a programmatic approach. So if you have a program or if you have an intervention that you're trying to replicate, rather think about how it can be replicated through these principles rather than through kind of a cookie cutter approach that plants these things from an outside in. Think about it from an inside out approach. Okay, I hope I did okay on time. I did, yay. I was hoping to leave a good amount of time for questions and discussion. And we have, it looks like about 15 minutes.
That's wonderful. Thank you so much, Cynthia. So we've had a good number of people in the audience, upwards of 60 at some times at the moment. And so I'm hoping there are some questions and comments. I see Margarita's raised her hand.
Thank you. Thank you, Cynthia. Thank you for this very interesting discussion. You know, as a very proud social worker, I think actually it's a pity that we as social workers don't value our theory more, because I also, after I studied social work, also did the MBA, and I was quite surprised that the things that the MBA people think is in the MBA environment see as discoveries. We've been doing for years. We've been doing it, but we've also been allowed ourselves to be bullied by funders in following approaches that is only one-dimensional and not acknowledging the systems that we're working in and the need to put community in the center of everything we do. Because we work in an environment where we're funded by government who wants to implement policies from the top. And we have to respond to that in order to survive. Well, to work in a project where there's no clear defined outcomes, it's not always so sexy for funders. They want to see something being built, something being established, and actually, you actually have to go into. We have to go and work in communities and be absolutely fearless in as to what will come out, and not dictate. We often have this impulse of coming and we want to be the saviors, while we should actually just hold communities to find those solutions for themselves and support and observe what are they already doing and how can we add to what people are already doing, which often they already sit with solutions which is just ignored by everybody who is supposed to wants to help them. So this is really amazing what you've done, and highlighting those issues and just bringing it also within the context of theory and putting a bit of a model around all of those aspects from the business perspective, the business systems perspective, because it's really for me, I'm really passionate about systems theory and how actually we can't separate the social system from the economic system, from the ecological system, and everything influence each other. And it's really wonderful to see that business thinking is moving closer to what social workers have been taught to do all these years, and really we've moved away from that. So thanks for reminding us again. Thank you.
Thanks so much, Marguerite. I really love that reflection, because in fact, when Francois and I were discovering, and I say that with tongue in cheek, what we realized was that this was the deep work that was happening in many organizations, and in fact, it wasn't being recognized as such, and organizations were not able to speak freely about the work that was really driving the true impact, because they were responding to what funders and experts were saying that they had to say. And we wanted to simply put language to what was happening so deeply in these organizations. And in fact, I'll just also add that the woman who started Child and Youth Finance was a social worker, has started many organizations, and she said exactly the same thing. She said, in fact, I've been talking about this for decades, but I haven't had the courage to say it out loud. This was what I was taught in school many, many decades ago. And I've been using all of that in my work, but not able to talk about it that way. So I think it's a wonderful, wonderful reflection. And yes, these are not discoveries at all. In fact, it's a rediscovery.
While we're waiting for others, I think one question I have is the relationship between your approach and approaches in theory of change approaches, where people, you know what that is, and how you see the two intersecting.
Great question, Dan. I actually have a love-hate relationship with theory of change. We did not reference it explicitly in the book because we didn't want to kind of bring up the mental models that we all hold about theory of change, because I think one of the it's not a criticism, it's a reflection on theory of change. I think too often we think of it as a static document, as something that is that we do it once and that we then use it for our monitoring and evaluation activities, and that we only have to come back to it when we do our reporting. In fact, I think theory of change, that the whole exercise that we go through in order to develop one is a very fruitful exercise that should be done as a continuous improvement exercise, not as a static once-off, just so that we can report back to funders and to external audiences. So my love-hate relationship is more about the fact that I think it should be a living tool, rather than something that we just kind of pack away in a box when we're done doing it.
So we are blessed to have on the in the webinar a bunch of people that are already involved in changing systems, including Carol Dean, who directs the specialized hospitals here. And I'm wondering if I see we have people in public health like Faria Khamaldin, and I'm just wondering if people who are involved in theory change, systems change, want to speak up.
Please do. Please do.
While they're building up courage to do so, I was intrigued, Cynthia, that you said we are part of the problem, or we may be part of the problem. You put it fairly gently, because we are part of the system. And so it's pretty tricky to ask those of us who are in leadership positions, or any position whatsoever, we're part of the system, so how do we affect change? And the other point that you made is we really need to reconfigure power in order for change. So I'm thinking, Marguerite's pointing out, well, she would know what many of the things are needed for in social work, what kinds of things have to change. But very often people, clinicians, I would put myself in that category, and social workers are really absolutely unable to change current power dynamics. And we're part of the problem. So your talk, although I'm sure it was intended to leave me enthusiastic, I also am little worried that about its implications.
Yes. Okay. So let me go back a little bit to the first organization that I worked with Mothers to Mothers. I think there absolutely was a source of strong expertise in that organization, continues to be to this day. It was started by a medical doctor. But that medical doctor, Mitch Besser, was very, I guess he came to consciousness over the course of his early years in practice in South Africa in communities working with mothers living with HIV, that in fact his expertise was landing on deaf ears, that he could talk about from his point of view, infinitum, but in fact that it wasn't going to resonate with those who he believed needed his expertise. And in fact, it was mothers themselves who were going to be able to be the source of expertise to those other mothers. So I would say that, in fact, we do need expertise, but we also need to understand where our voice can be heard best and who best can deliver messages. And also being able to recognize that, in fact, the sources of empathy, the sources of caring, the sources of stories that are going to connect with those who are going to take that information and live it in their very lives is often not the same as the source of clinical expertise. And that's in one very specific case study, but we found that it was actually replicated in other sectors as well. So in the case of Family Independence International, again, working with very dedicated, very passionate social workers who had been working in the social services systems oftentimes for many years and feeling a sense of great disheartenment because in fact, the things that they knew were not being implemented in families. And in fact, it wasn't just a matter of the messenger, it was seeing families as true experts of their own lives, and then being able to then support families, but not kind of come in with this belief that their ways were going to be the ways that had to be the only way. Another organization that we studied was Buurtzorg, an organization out of the Netherlands, but also operates globally. This is an organization that works with nurse teams, neighborhood nurses. And in this case, I would say that the neighborhood nurses are in fact the primary actors. They are experts at neighborhood nursing, at nursing. But in fact, they would also come in and become members of the community and members of those families. So it was one thing to kind of launch in a nurse who was just going to do the high level care and then launch them out again. And another thing to embed a nurse in a community so that she or he became a true expert of all of the sources of expertise in that community and could connect families to that. And that in that case, the expert is in fact the primary actor, but operating in a very different way. So I hope that gives a few examples of the way we can reconfigure power, but not lose sources of great expertise. We don't want to lose that expertise, but we want to channel it in different ways.
That's very helpful. Fadi has written in the chat box, Cynthia, I think that the institutional culture medical model in which you provide services doesn't always facilitate collaboration. Families are experts in their own lives, and that's related to expanding community-based services and networks. I mean, I seem to remember that the Bertha Center has consulted with hospitals in the past, and are there ways in which we could potentially draw on your expertise going forward? We have different divisions in the department. We have nurses in the department, and working with families. I mean, are there ways in which we can draw on your expertise in the future, do you think, perhaps, possibly?
Absolutely. So we have at the Bertha Center, we have portfolios of activity, and oftentimes they are engaged with the faculty at the Graduate School of Business, and other times we work directly with community-based organizations. These portfolios right now are including a youth development effort, health systems portfolio, an education portfolio, and a financing portfolio. So, and each of those have, I think, to work that is being done in the medical field. So we would love to engage. I would be happy to either engage individually and try and connect to the right person, or we can talk, Dan, as a department, either one, whatever makes sense.
I think that's really, really a wonderful offer, and I would really encourage managers and our department heads of divisions to reach out to you. It may be helpful to get concrete. One of the our registrars, psychiatrists in training, Jacob Hoffman, has written, thanks to the presentation, clinical practice, we often have patients with substance use problems, but there are contextual elements that are difficult for us to address. How do we change the system with regard to substance use? That's the sort of thing, that's a very concrete example that faces us day to day, and which is a wicked problem. And that I don't know if it'd be the best place to start, but it's certainly one place to start. I wonder if you have any thoughts.
Yeah, in fact, one of the organizations that we studied, I didn't profile them here today, but an organization called Our Labs. They don't deal explicitly with substance abuse, but many of the youth that come through their program are either substance abusers or come from families where substance abuse is a problem. You know, it's interesting, and I am taking a non-clinical point of view here, but what we realized that organization was doing at a very deep level was creating an identity amongst those youth that were oftentimes allowing them to feel connected outside of the identities that they had built in their communities, whether it was belonging to a gang or acting as a drug dealer, coming from families that oftentimes had issues. And so that haven, a place, first of all, for them to separate from the things in their day-to-day lives, and then connect with others around a new identity. And then in this case, the identity is tech entrepreneurship. Okay, it really could have been anything, I will say, but in fact, tech entrepreneurship is something that they were able to connect on and feel this sense of empowerment, you know, not just empowerment as an individual, but an empowerment as a group. And oftentimes I think we too much think about the individual identity and we work on an individual level, whereas in fact that collective identity was what was keeping the youth coming back, and over time changing the way they engaged back into their community. So that's a very kind of high level response, but we really saw that collective identity was something that was being underappreciated in many of the organizations that we studied. But in fact, it was really being invested in, and funders or external people looking at the program were not appreciating how much of that work was working to shift the way those youth were then going back into their communities, back into their families.
So one free association I have to that is sort of that one of the things for us that I don't think that remains a challenge is the occupations of our patients. So we do have occupational therapists, and we do try to skill patients, and there is a certain amount of work going on, that's for sure. But I'm just thinking that you're in a business school. In the old days, which were not necessarily better, but patients at Falkenberg produced vegetables that were then sold and were reintroduced into the workforce in a number of ways. There is extremely good evidence that if you give people work on discharge, that it helps them clinically. But we don't always have the resources or the know-how in order to begin sustainable entrepreneurial, whatever that word is, activities for our patients. And is this something else that the Bertha Center could perhaps help us think through?
Yes, absolutely. It's one of the things that I've found kind of oftentimes is a tack on to a program, but in fact, a fully integrated program that is looking at kind of all aspects of up a little bit. Many of the organizations that we've seen use income generating as kind of a tack on. What I would promote is the idea that it should be fully integrated into a program, seen as not just a way to generate income, but seen as a way to increase the self-efficacy of an individual as well as a community. And that's what I think would be interesting, is not looking at it as, okay, these people, these individuals need income, let's give them a way to earn money, but rather think of it as a fully integrated piece to a program. I think that could be really exciting and interesting.
Yeah, so in conclusion, it is 1:30. There are further pieces on the chat, people saying thank you, Marinda asking about stigma. We probably do have to stop, but I think the birth center is a hugely important aspect of the university, and I think we could potentially set up lots of kinds of projects together if there were an appetite for that inside of the center. So I would really encourage everyone on the call to reach out to you, Cynthia. And Cynthia saying, thank you so much for not only the presentation, but also for saying that you're open to that sort of interaction going forward. That's really wonderful.
Absolutely,
Thanks.
That would be a wonderful output of this. Thank you very much.
Take care.
Thanks, everyone. It was great to be here, and thanks so much for the invitation, Mark. Really appreciate it.